Okay, Pam, thanks for that history. I'm going to have a look at your musculoskeletal system now, if that's okay. We'll start with your upper body.
Okay.
Okay, lovely. I'm just going to put some gel on my hand, and while I do that, I'm just going to have a look at you. Can I start by looking at your hands? If you just pop them on your lap there, that's fine. Thank you very much. Okay, I'm just going to take your pulse on this side, and I'm going to squash your finger for a moment and let it go. And what I'm going to do now, Pam, is I'm going to feel the joints like this, and I want you to tell me if anything feels uncomfortable or painful.
Okay.
And then just bend your knuckles slightly. All feel okay?
Yeah.
Now if you just cock your thumb up, and I'm just going to press in there. Thank you. And round there. All okay?
Yes.
I'm going to do the same on this side now. Just going to feel your pulse first of all, and then squash your finger as I did before. That's great. And now I'm going to feel the joints. Just cock your thumb up again for me. Okay, what I'm going to do now is just tap away. Does that give you any tingling sensation or pins and needles in your hand?
No.
Can I do that on that side? Feel okay?
Yeah.
So what I'm going to ask you now is to do some movements of your fingers, okay? So the first thing is just hold your hands out like that and make a fist on both sides. And straighten out again and spread the fingers out as wide as they'll go and bring them back in. And then if you'll put your thumbs in line with your index finger and just lift it straight up and down and across your palm and then out to the side as far as it'll go. And then can you touch your thumb to the end of each finger like this, nice and slowly, each one on both sides. And now I'm going to ask you to pray like that. Put your hands together and bring your elbows exactly as they are. That's right. And now reverse that like that. When you do that, does that produce any sensation of pain or tingling?
No.
That's okay. All right. Lastly, could you put your hands on your lap? Okay, I'm just going to hold your wrists, and I want you to sort of make a windscreen wiper motion with your hands. That way and that way. No problems with that?
No.
Okay, we'll move on to your elbows now.
Okay.
So I'm just going to have a look at your elbows first. And what I'm going to do is just feel those bits there and straighten them out there. And now I'm going to feel round your elbow. Again, tell me if it's tender anywhere, especially there, if it's painful.
Okay.
Okay, thank you. And now I'm going to have a look at this one. And again, put fingers on your elbow and do that and straighten it out, okay?
Mm-hmm.
And again, I'm going to feel the little nodes under your arm, and I'm going to feel all around there. So if you put your arms out straight for me, and then bend them as much as you can, and straighten them out again. And now bring your elbows to your tummy, and I want you to put your hands flat out and turn them over and back. Okay, just relax your elbows. What I'm going to do now, Pam, is have a look at your shoulders, if that's okay. So the first thing I'm going to do is just walk around and have a look at the symmetry of your shoulders.
Okay.
And the next thing I'm going to do is to just feel your collarbone and your shoulder area there, all right? Tell me if there's any pain or tenderness when I press on the structures of your shoulder, okay? That area there sometimes feels a bit tender. Okay in there?
Yeah.
I'm going to feel around the joint. And okay there?
Yeah.
Now if you just put your elbow into your tummy, and I just want you to put your hand straight and do that for me while I do that. That's fine, thank you. Just checking the back. And now we're going to do the same on the other side. So just checking your collarbone. Okay there?
Yeah.
Okay there and round there. Not tender there. And lastly, once again, if you put your elbow to your tummy and just move that in the same way. Not tender there. Okay, right. What I'm going to do now is ask you to stand up, Pam, for me. Okay, and I'll demonstrate, if you just stand a little bit closer to the bed there, I'll demonstrate the movements I want you to do. Mind the rail there. I want you to wave your arms up like a Mexican wave, right up to the top and all the way back down, and then round to the back as if you're going to dive without moving your neck forward. That's fine. If you just turn a little bit this way, and now I want you to bring your arms out to the sides with the arms straight and clap at the top. Thank you. Now if you'll turn away from me, okay, I want you to reach your arms down the back of your neck, so both hands together that way, as far down there as you can. And now bring your arms out and reverse that, and I want you to pretend you're doing up a bra strap. Bring your two hands together as high as you can. Thank you very much. Okay, if you come back to the chair, what I'm going to do now is just check your jaw, so just be nice and relaxed, and I'm going to just palpate the joint. Is it sore when I do that?
No.
We'll do some movements now. I want you to move your jaw up and down and from side to side and forwards and backwards. Thank you very much. I'm going to move on to your neck last of all, so just nice relaxed position with your head upright like that. And now I'm going to just palpate your neck, Pam. I'm going to hold your forehead, okay, and I'm going to use my thumb like that. And I want you to tell me again if it's sore when I press on your neck. And then the muscles either side. Is that okay?
Yeah.
What I'm going to ask you to do now is to turn your head to the right as far as you can see over your right shoulder, and now to the left. Does that produce any odd feelings in your fingers, any numbness? Okay, so now I want you to put your chin on your chest as far down as you can, and then bring your head looking up to the sky as far back as you can. Is that okay? Bring your head back to neutral, and now I'm going to ask you to put your right ear on your right shoulder, that way, and your left ear on your left shoulder. Does that feel okay?
Yes.
Okay, that's the examination of your upper body complete and everything is fine. Okay, Pam, thanks for giving me that history. What I'm going to do now is examine your lower musculoskeletal system, okay? So the first thing I'm just going to do is have a look at you. And then I'm going to examine your neck, okay? So if I may, I'm going to put my hand on your forehead and I'm going to feel the back of your neck. I want you to tell me if it's sore at all when I do that. Is that okay?
Yes.
Any discomfort when I do that?
No.
Okay. What I'm going to do now then is ask you to move your head. So the first thing I'd like you to do is to turn your head to the right and then to the left. Does that feel okay?
Yeah.
Now can you put your chin on your chest and bend your neck as far as you can, and then slowly come upwards and look upwards and backwards as far as you can. Is that okay?
Yeah.
Lastly, I'm just going to hold your shoulders, and I want you to put your right ear on your right shoulder and then left ear on the left shoulder. Does that feel okay?
Yeah.
Okay. I wonder if I could have a look at your back now, if you wouldn't mind taking off your t-shirt for a moment. and just relax with your arms by your sides. What I'm going to do now, I'm going to do the same thing with my thumb and feel down your spine. Again, if it's tender in any way or sore, let me know. Is that okay?
Yeah.
Now I'm going to feel the muscles either side of your spine, and again I'd like you to tell me if it's tender anywhere. Is that okay?
Yeah.
Okay, pop your shirt back on, and what we're going to do now is some movements of the spine. The first movement we're going to do with you seated on the bed. Okay, so if you put your arms like that, like a genie, okay, and I'd just like you to twist to the right as far as you can. Take your body and head with you, okay, and now twist to the left as far as you can. Okay, lovely. Now then, if you could stand up and just stand here for me with enough room, because what we're going to do, I think we'll turn you towards the chair. That's great. I'm just going to watch your back as you reach down and touch your toes. Reach forward and come up slowly. That's great. And now come backwards as far as you can. So lean backwards. Okay. And lastly, what I'd like you to do is to reach down with your left arm down towards your knee. I'm just going to stabilize your spine as you do that. And turn to the right. And do the same. Okay. Okay? Right. Could you pop onto the bed now, Pam? Okay. Get nice and comfortable. Is that okay?
Yeah.
Okay, so we're going to focus on your legs and pelvis now. Okay. So first of all, I'm just having a look. Okay. And what I'm going to just do is press on the bursa, which is just on the point of the hip there. Is that okay?
Yeah.
So what we're going to do now is some movements, and in order to do that, I'm just going to flatten the bed out a bit. Okay, Pam, what we're going to do now is to do some movements of your hip joint, okay? And what I'm going to ask you to do is to do the right side first, and to bend your knee and your hip so that your knee comes up as close to your chin as you can make it. Okay, and the same on the other side. Okay, that's grand. Now what I'm going to do is just stabilize your hips here. I want you to bring this leg out to the right, as far out as you can, and then across inside and across as far as you can. Okay, and now I'm going to stabilize this side. Can you do the same with the opposite limb? As far out and across as you can go. Okay, thank you. Now if you bend this knee and put your foot flat on the bed, I want you to push your knee into the middle like that, as far as it will go, and then out as far as it will go that way, and then pop your leg straight and do the same on the other side. And straighten your leg. Is that okay?
Yeah.
So what I'm going to do next is to have a look at your knees. Okay, so just relax there. And I'm going to just feel to see if they're hot, which they're not. And then I'm going to put my hands on, and I'm just going to see if there's any swelling inside your knee. Is that okay when I do that? Okay. And now the same sort of thing. Thank you. I'm just going to feel all the way around the knee. Can you bend your knee now, please? That's grand. And now I'm just going to pull your leg forward and backwards. Okay? You can straighten your leg now. So can you push your leg down as far as it'll go onto the bed, and then bend your knee to bring your foot as close to your bottom, or your heel as close to the bottom as you can, and straighten it again. Okay, we're going to do the same thing on the opposite side now. Same thing. And bend your knee. And again, I'm just going to pull the knee forward and push back. And again, can you bend your knee now? Straighten it first, push it down into the bed, and then bend your knee as far as it'll go and back down. Okay? Yeah. Okay, we're going to have a look at your ankles now. And I'm just going to feel each foot and ankle in turn. And I'm going to feel the pulse in your foot and your ankle. Okay, just bring your foot up slightly and just relax. Anything sore when I do that? Okay, and I'm going to come to this side and do the same. Is that okay? Okay. So, if you point your toes downwards and bring your feet as far back as you can, like that, okay. I'm going to do the next bit, so just relax your ankle. I'm going to twist your foot inwards and outwards. And relax, inwards and outwards. And just twinkle your toes for me. Thank you, Pam. I'm going to ask you now to turn onto your tummy for this last bit. Okay, so I'm just having a look at the backs of your legs. I'm just going to feel at the backs of your knees for any swellings, which there are none. Any tenderness when I press on there? Is that side okay as well? Yeah. They're okay? Yeah. And they're okay. Okay, while you're in that position, I want you to take your whole of your left leg and just lift it off the bed as high as you can with your leg straight. Okay? And can you do that on the other side, please? That's fine. So if you slowly roll over and sit on the edge of the bed. That's fine. Do you feel okay? You don't feel dizzy? No. Okay, if you can get up then slowly. Just make sure you don't feel dizzy. Okay, and just take an ordinary walk for me, up and down, and turn around. That's fine. That completes the musculoskeletal examination. Thank you very much.